Hello friends, today I'm going to speak on the topic battered baby syndrome. A battered child is one who has received repetitive physical injuries as a result of non-accidental violence produced by a parent or a guardian. The synonyms include CAFE syndrome, CAFE-Kempis syndrome, maltreatment syndrome, and parent-infant traumatic stress syndrome. So coming to the features related to the child, the age of the child will be usually below 3 years of age. The male to female ratio is 2:1. So the status of the child is illegitimate and unwanted children, like pregnancy before marriage or failure of contraception. The position in the family will be the eldest or the youngest. Child may be a mentally abnormal one. So coming to the precipitating factors, the act of disobedience by the child, frequent crying by the child, refusal to take food, napkin, soiling of the napkin or the bedclothes, any trivial act of a child that may annoy a mentally challenged parent. So features arising suspicion of abuse, vague and inconsistent history given by the parents, late medical attention, injuries in different stages of healing. In many cases, the parents later admit to have assaulted their children. So, how to differentiate from accidental injuries? They typically involve the bony prominences of the body, like the head, the nose, the chin, the elbows, knees, and skin. Chin. Match the history given by the parents. Surface injuries like bruises, abrasions, and lacerations will be present. Laceration of the oral mucosa along with the labial frenum of the lower lip is a characteristic lesion. Slap marks may be present, lash marks may be present, knuckle pinches, pinch marks, bald patches on the scalp due to pulling out of the hair may be also seen. The eyes will show retinal hemorrhages and lens displacement may be seen due to slapping. Visceral injuries like injuries to the spleen and liver may happen. Burn injuries like small circular pitted burns that indicate deliberate stabbing of the cigarette ends on the skin. Skeletal injuries like bony injuries include fractures, subperiosteal hematoma, and multiple deformities of the long bone may be seen. The fracture of the ribs heals by callus formation in 1 to 2 weeks, giving characteristic appearance of a knob fracture. These are the knobs that are seen. X-ray will show a string of bead appearance in the prevertebral gutter. This is the string of beads that is seen in the X-ray. That is characteristics of the injury caused by the parents. In whiplash movement of the arms and the legs, corner or bucket handle fracture may be seen. This is the bucket handle fracture may be seen. These are typical radiographic appearances. The CVS due to blunt trauma to the chest may cause multiple rib fractures leading to lung and heart contusions, pneumothorax, hemothorax, rupture of the diaphragm and cardiac tamponade. The genitourinary system, physical and sexual abuse should be considered in a child presenting with hematuria, dysuria, increased frequency of urination and enuresis. So coming to the diagnosis, depending on the nature of the injuries, that is recurrent injuries that are in different stages of healing, delay in seeking the medical treatment by the parents, radiographic manifestations should help us diagnose this syndrome. Coming to the Munchausen syndrome by proxy. The Munchausen syndrome by proxy is a form of abuse in which the parents or the guardian fabricates or produce symptoms of illness in a child in order to gain sympathy or attention for themselves. The parents frequently have abnormal or borderline personality disorder. The diagnosis may require high level of suspicion and may be met with considerable resistance from family. So the features include the child will be brought with vague complaints inflicted by the parent that is intentionally and repeatedly, such as bleeding caused by anticoagulants and simulated by exogenous blood, seizures by suffocations, shaking or intoxicants, vomiting by giving ipecac syrup, the fever triggered by injecting contaminants into the IV lines. These are the injuries that the parents inflicts on the child. The parent or the guardian derives some non-economic benefit at the expense of the victim. Some perpetrators doctor shop while some maintain a constant relationship with one or more healthy care providers. When confronted, the parent or the guardian usually denies any allegations. So, coming to the diagnosis, the illness does not conform to the expected presentation. Signs and symptoms are not substantiated by the laboratory findings. Failure of the wounds to heal. The child becomes ill or worsens when the parent is around and will starts recovering when separated from the parent. Positive toxicological analysis for something that is not prescribed by the doctor. Admitted to multiple hospitals and seen by multiple physicians. So this concludes my presentation. Thank you.